Hello everybody, welcome back. Today we are going to see together how to leverage healthy longevity through different fasting regimens. For me, there are only two fasting regimens, short and long term, but there are a lot of variations of restricting the food intake can lead to some of the benefits of real fasting. And I will try to go with you through this abundance of possibilities of today's life. Hello, everybody. My name is Françoise Wilhelmi de Toledo. I'm very happy today to present you our last publication. It was an editorial in Public Health and Toxicology called Leveraging the Self-Healing Abilities of Our Body to Promote Healthy Longevity. We are talking about fasting, and I will try to give you an actual picture of the several fasting regimens. And of course, first, what is fasting? Fasting is a physiological ability of humans and animals to continue living and producing energy for their several activities when food is not available anymore. This happens during the night and during the seasons where no food is produced. But metabolism is able to switch from the use of food glucose that is not available anymore to the use of endogenous substrates, mainly our own fat. Fat is going to nourish our body cells. Without this ability of fasting, the human species would have not survived in the course of evolution. Yes, you must understand the human body is like a hybrid car. It was not always that the food is permanently available like today, where you have food in an overabundance. The history of humans and animals is a history of scarce food. You have to look for it, you have to fight for it, you have to do strenuous exercise to get it. And the better example is during the night. Humans are programmed since the beginning of life to fast and sleep during the darkness, during the night, and to eat and have several activities during the day. So the night fasting exercise or trains already the switch, the metabolic switch from using the food energy and during that time switching to the own endogenous reserves of fat mainly and sugar. The other big period where humans, especially let's say in the cave times, wouldn't have food for a long period of time, it's during the winter or the equivalent of the winter in some seasons where the earth doesn't produce food anymore. And animals and humans have several strategies. Probably they have hibernated, at least they have fasted long periods. Animals migrate, and during the migrations, they use the reserves they have accumulated in the good season to migrate to warm countries. And this normal ability, this physiological ability is a necessity, exactly like sleeping is a necessity, fasting is a necessity. And in Western lifestyle, in the industrialized countries, we have a chronic fasting deprivation. And this prevents our long living time. It prevents good health in many cases. It leads to obesity, to cardiovascular diseases, to diabetes type 2 and all the consequences, and probably also to cancer. Now, the real question is, how long should we fast? How often, with which frequency should we repeat the fasting? And should we supplement it or not? Certainly, we should supplement it with water, but There are other variations, other different regimens I would like to present to you today. In the experience of Buchinger Wilhelmi, these are fasting clinics that this year are celebrating their 70th anniversary in the south of Germany, in Überlingen, and 50th anniversary in south of Spain, in Marbella. We have a big experience of human fasting because we propose fasting periods of 5 to 20 days with medical supervision and a multidisciplinary accompaniment. So we can really share our clinical experience with you. And we have different patterns according to if you have healthy subjects or if the persons are ill. With the research, we have now a research department, we try to understand the mechanism through which fasting can be used as a therapy or prevention. There are a lot of changes when you fast, almost everything is changing. Biochemical changes, gene activation or sequence of genes activation changes. And clinically, there are a lot of changes too. And there is also a lot of experience in religions we can also use. And then the research of today has mainly animal models, which also permit experimentation, but they are most of the time very small, and it's very difficult to take these experiments always for humans. So the recommendation of the clinics Buchinger Wilhelmi, they see 6,000 subjects per year fasting or doing some kind of dietary restriction. We recommend to do every day intermittent fasting, and you can choose a period to fast overnight. It can be 10 hours, 12 hours, 14, 16, at least a long period of fasting where you only drink water or non-caloric beverages. This is called today intermittent fasting. It is a physiological way to do the things. And then we propose to follow the rhythm of the seasons and have every year a long-term fasting, which means that either you take only water, and this for 5 days, 10 days, 15, 20, sometimes more, or you have a minimal supplemented fasting regimen, like the Buchinger Wilhelmi. We call it Heilfasten in German. This means heal fasten, because it's used for curing diseases, for prevention, and also it's always supervised by a medical doctor. Then this fasting regimen, Buchinger Wilhelmi, brings 70 to 250 calories per day. And there are other recommendations. It's not only what you eat or not eat and with which frequency. We recommend to do a long-term fasting, to be away from everyday routine, if possible, away from your profession, maybe your family, and in a natural place with good vibrations and pure air, healthy environment. If possible, take holidays for that. And we propose in our clinics multidisciplinary care with high touch and low tech. This means medical supervision from the first to the last day, supervision also with films and an accompaniment afterwards at home, because the phase of food reintroduction is as important as the fasting itself. We have also nutritionists, physiotherapists, massage, fitness training, psychotherapy, and all together we cultivate a spirit of inspiration through a certain silence, beauty, the group dynamic, and of course a very, very intense care for the people fasting, meditation, and some elements of religious practice too. So in any cases, and for every situation, every person, we always propose the fasting with 3 dimensions. The medical care is extremely important and has a lot of staff. But there is a community dimension, and many religions cultivate that. Take the Ramadan in the Muslim world. The people grow together, they support each other, they communicate, they exchange at a very much profound level. It's not blah blah. It's really you are more in touch with your inner self, and people appreciate that, discover other people in a very peaceful situation. Probably the tolerance is increased and the solidarity too. And this is why probably religions have also used the fasting. Then there is this spiritual dimension. Even if you're not a religious person, you will feel it when you fast long term and you are in a secure atmosphere, in a place with a lot of experience and professionalism. Then you will notice that the tendency is to live in your inner self, maybe to check what was the last period of your life, maybe last year, if you do it every year. And you will probably sleep differently, maybe have dreams, and have moments of high consciousness. This is not always the same by everyone, but this dimension is always there. And these three dimensions help for the perfect compliance. If you do only the medical thing, you observe only your parameters, your vital parameters, you might make a record and be happy with that. But to do it regularly and to appreciate and to be happy during the fasting, community and the inspirational dimension are very important. Now, many people don't consider only the short-term fasting of the night and the long-term seasonal fasting. They consider other forms of fasting. I consider them more as diets. Or we can call them restrictive nutritional strategies. They can last one day, several days, or sometimes weeks. It's, for instance, the calorie restriction. It has also many of the therapeutical aspects of fast, but of course, not all dimensions and not all benefits. And then you can restrict in your diet some macronutrient. We have done long years the low fat with little good results. Then the low carb, which is the ketogenic diet, has many advantages and benefits, especially for metabolic diseases like diabetes type 2. You reduce considerably the carbs and enhance the quantity of good fats, which doesn't mean the fats you can buy in the supermarkets, but this means organic, cold press oils that comes from the right grains or oil seeds. And there is a new tendency. You can also reduce for a certain period of time the proteins. And this has own effect too. So today, this is experimented in many research units, how to modulate these micronutrients. Then there is the time-restricted regimens, time-restricted regimens like intermittent fasting. But anyway, this is a very new dimension, which is extremely important. If you eat during the night, let's say, it's the wrong moment to eat for a human. So you will have with the same food, when you eat it at the wrong moment, you can have negative effects and benefits when you do it at the right time. So eating during daytime is important, but not during nighttime, and leaving enough space during the meal so that the appetite can regenerate. The best nutritional strategies, even if they are restrictive, it's home cooking, because you can have very palatable food, reducing the calories and knowing what you are eating. There are periodic programs that are also offered on the market, and I just mentioned two of them, the fasting mimicking diets, because they are called diets, And there are diets, they are around 800 to 1200 calories, and they are low carb, low protein, and have some good fats. I can present, of course, the fasting box developed by Buchinger Wilhelmi. It's not a fasting, it's a diet, very restricted in calories, also restricted in carbs and in proteins, and having a good proportion of high quality fats like linseed oil and others. You can find the description of this fasting box in the description. And if you want to sum up all the diets I have mentioned and the two sorts of fasting, they bring some of these results. The results I'm going to tell you or to describe for you are the ones we have observed with long-term fasting, Buchinger Wilhelmi fasting, minimally supplemented with juices, vegetable broths, sometimes only vegetable broths, giving you 75 to 250 calories according to which supplements you take. You have diminution of the weight, diminution of the blood pressure. All that has been published, and you can find in the description the list of our last publications that document all these variations in these parameters. And it diminishes the glucose levels. The glucose is setting at the low level of the lowest level of the norm and stays there like it is a steady state. Diminution of insulin, of glucose, and IGF-1 are three extremely important parameters for longevity as anti-tumoral situation and for many other diseases. And then the ketosis is starting. We measured in the long-term fasting in humans that ketosis reaches its highest level after 2 to 3 days. And then there is a normalization of fat and carbohydrate metabolism, which leads, for instance, in diabetics that we have to eliminate the drugs or reduce them, even the insulin, at least during the time of the fasting. And then with a ketogenic diet afterwards and following exercise program, you might have the hope to stabilize the whole. And we have made a study also who shows an extremely improvement of the fatty liver index. So this is very promising. Other very important benefits are the cellular repair and rejuvenation through enhancing autophagy and apoptosis. This is probably the most important benefit if you consider longevity or healthy longevity, and that was the title of our film. Autophagy and mitophagy, this means that our system is able to repair the cells or the mitochondria, which are the producers of energy in the cells. We can repair them through a mechanism of self-digestion. And after the fasting, there will be, or during the fasting already, there will be a regeneration mechanism. Younger cells will come instead of the old or the senescent cells, which were really cluttering the cells, impeding sometimes the function. The apoptosis is the elimination of old cells that cannot be repaired anymore. So you have a sort of extremely big cleaning mechanism during fasting. Then the protein synthesis and stem cell activation will take place during the fasting, but especially after the fasting. And this leads to cell regeneration. It has been demonstrated in immune cells of all the lines, and mitochondrial regeneration, which leads to an improvement of the energy feeling, boost your energy. And many people have this chronic fatigue. They are tired all the time, or they feel that they don't have drive anymore, and the fasting is boosting this energy production. And we have other very important effects. And all these effects have been demonstrated in big groups of persons doing the Buchinger-Wilhelmi long-term fasting. You have a reduction of oxidative stress, especially in the lipids, so it's good for the membranes, and an enhancement of the antioxidant capacity through the elevation of the uric acid, which is an extremely potent antioxidant. We have done other videos you can find in the description on that topic. We published just last month review in Cell Press dealing with the changes in the whole ecosystem of the intestine. The mucosal wall is changing, is having a sort of decrease, like a sort of atrophy, periodic atrophy, momentaneous atrophy, and then will be reconstructed anew after the fasting. This goes together with a change in the microbiome. The name of the publication is in the description. And you have a mood enhancement and a stress reduction in our clinics. Cortisol goes down. It's not always the case, but probably because people are really taken care of and they can relax and they can be confident. It increases also the cognitive abilities. And it resets the circadian clocks, meaning that when you do a long travel, for instance, by plane, you can, by having periods of fasting followed by a certain strategy of eating, diminish the jet lag, cope better with the jet lag. And the fasting has anti-tumoral effects, which are researched a lot in the moment. You have the diminution of the IGF-1, the growth factors, which are necessary for the growth of the tumor, an increase of IGF-PB1, a disactivation of mTOR because you don't eat proteins anymore or much less, or some amino acids are reduced, deactivation of the RAS-PKA, which is induced by glucose, and more effects still that we will tell about in the next publications and next films. You can have some of these effects of the long-term fasting under this ideal situation I described to you with other types of nutritional strategies, always restricted. Modified fasting, there are several examples. It's difficult to say until when it's fasting and since when it is a diet. But more or less 25% of the required energy, or 500 calories, everything that is above 500 calories can be considered as a diet, a restrictive diet, and under this maybe a fast. But there the definitions are different according to the places and the people. There are also alternate day fasting, where you fast one day, that can be water fasting, and the next day you eat as usual, and you alternate like that. It has also some of the benefits. Therapeutical medical fasting versus preventive fasting, but this is just a definition of the intentions. Then you have the fasting mimicking diet, which uses the idea of time restriction. And during the window of time where you can eat, you can also restricted eat, or you can eat as usual. So you see the variations are almost infinite. And for us, we considered the period after the fasting as belonging to the fasting, especially if you fast for an illness like rheumatoid arthritis or inflammatory diseases. We have made a meta-analysis a long time ago, which is still very much quoted, where we showed that for rheumatoid arthritis, you have an extreme improvement during long-term fasting. But if you reintroduce the food without a very severe and very strict pattern, you have a relapse quite soon. and this is terrible for the people. One study published in the Lancet almost 30 years ago showed a stabilization of and a consolidation of the improvements with a very, very severe pattern of food reintroduction during the 3 months after the long-term fasting. And then you have the periodic fasting. Periodic fasting means that the ability of fasting is always repetitive. If you fast during the night, you would do a daily fasting, so a periodic fasting of 1 day, if you want, or some hours, repeat it all the time. If you do a long-term fasting once a year, then you have a yearly repetition of the fasting. And in our clinic, we have more than 50% of the people who come regularly to fast. Most of them yearly, some of them 2 yearly. Some people come also more often for shorter periods of time. And then some people talk about the religious fasting is the fasting that is offered really by religions in a liturgic time. It's the Lent in Christianity, is the Yom Kippur in Jewish tradition, and Ramadan. So you see, there are so many possibilities to fast or to take some of the benefits of fasting with restrictive eating patterns. If you want to know how to fast the right way with the 3 dimensions and taking the most of benefits of it, not only the physical one, but also others, then look at the book I wrote some years ago, Therapeutic Fasting, the Buchinger Amplius Method. The title is in the description, and you can also look at all the publications we did in the last years if some of the aspect of this topic has interested you especially. I hope to see you again, and I hope you enjoyed this video.